16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 38 85 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.
The best investment that you can make is in your own health, because the groundwork of all happiness is good health. Good evening, everyone. This is Anupama Menon welcoming you to a brand new episode of BMC Global Life Hilal Health World, Nothing But Lifestyle. In this talk show, we have expert doctors from various fields providing valuable information to all of you to assist you all in your journey towards good health. Constipation is a very common problem that affects people of all ages. And as we all know, good bowel movements are very essential for a person's overall well-being. Today, to throw light on this topic, we have with us Dr. Suresh Daivasikamani, Consultant Gastroenterologist at Hilal Hospital, Muharraq. We are very fortunate to have him with us today because he comes with a wealth of experience. He has over 32 years of experience in this field, and his area of expertise is endoscopy, colonoscopy, liver and pancreatic diseases. So we'll move over to him to know more about this topic. Welcome to the show, doctor, and thank you for joining us.
Thank you so much. Good evening.
So doctor, can we begin by explaining what exactly is constipation?
Yes, it's a very nice question. Constipation is something that everybody faces in their life one time or other, either as a short duration or for a longer duration. Nobody can say they did not suffer from constipation in their life. Constipation, as per the definition, if you pass 3 motions per week, it is enough. But in addition to that, we want to inform you that any motion which is very hard, very dry, when you are passing the motion you experience pain, or you after passing the motion you feel still there is incomplete evacuation, all this will be considered as constipation.
Okay, so this is something new to us. So passing motion thrice a week is more than enough. Okay,
but
so it's not necessary that
yes,
every day
but
you
in
need
addition, patients start feeling pain when you are passing the motion, or they have to put the hard motion, they have to put effort.
Okay.
Or the patient feels after passing the motion they have not passed enough motion, still something is there, then that also would be part of the constipation.
So what causes constipation?
See, most of the time the constipation occurs only because of the simple common reasons like unbalanced diet, not taking adequate fluid, or lifestyle, abnormal lifestyles or altered lifestyles, or they might have some simple diseases, underlying diseases like diabetes, thyroid, other things, and also some stress, those who have extreme stress, and bowel fashioning, bowel habits, improper training of the bowel habits at the younger age. If you do not train your bowel habits at younger age, you tend to develop constipation at subsequently.
So what are the common causes in your observation? What are the common causes of constipation?
Yes, as I told you previously, diet habits, bowel habits, lifestyle, underlying medical diseases, or medicines you take. You take some people have to take medicines either for a short duration or for long duration, but lot of medications can cause constipation, or some intrinsic diseases in the intestines or in the abdomen.
Okay, so it could be a lifestyle disease also, and
as simple as
be,
that, yes.
Yeah, as simple as that, yeah. And it could also be something more serious. So you spoke about the lifestyle. So what are the dietary? Because we normally link constipation to diet. We are all under the impression
very
that certain
important.
food.
What is constipation? Stool. What is stool? It is formed from the food. What we eat as a food comes after metabolism, after digestion as a stool. So what we take only will come out naturally. Supposing you do not take adequate food, you do extreme fasting, excessive fasting, undereat. So taking adequate amount of food, particularly food which is rich in fibers, most of the fibers we get from vegetables, fruits, legumes, cereals, prunes, all these things have lot of fibers. When you take food which is rich in these things, your bulk of the motion will be increased, automatically you will not have much constipation. On the other hand, you take dominant high fat food, cheese, butter, dairy products predominantly, and less of this, you have more chance of a constipation because they do not produce the bulk. In addition, liquids, particularly we are living in a country which is
centrally
hot,
conditioned,
and you have to take lot of liquids, not only water, at least water, any liquids, and you should also avoid liquids which are vegetable soup, vegetable salads, fruits, fruit juices, all these mentioned will be good enough, but avoid caffeinated drinks too much.
Okay.
Alcohol, please avoid these two things particularly because they create lot of dehydration and they cause the mismatch. Also medications. You may be a patient who takes some medication for short duration or for long duration. Look into the medicines you are taking, or check whether you are having underlying diseases. It may be a very common disease also, but they also contribute to constipation.
So caffeine and alcohol to be avoided, and a very balanced diet.
A caffeinated drink should be reduced.
Okay, and include more of fiber in your diet.
Exactly.
So what are the complications that could arise from constipation? Any other impact that it could have on your general health?
Exactly. See, constipation, for example, good evacuation of the bowel gives you satisfaction. It gives, particularly you go for satisfactory motion in the morning, it gives you you feel very comfortable and the whole day rolls easily for you. Also, if you do not have you have a feeling that you are not evacuated sufficiently, you always have some discomfort in the abdomen, you feel uncomfortable whole day. In addition, chronic or long term constipation, you put effort, you could the opening of the anus, the blood vessels become big and it is called hemorrhoids or piles, and it might bust and bleed. Or the anal ring, if you put constipation, the hard painful motion, it will cause cut, it is called fissure, it will produce extreme pain, you may get infected, you may become abscess, fistulas, etc. So, these are very common, piles if you ask anybody, or fissure, all these things are due to constipation and straining in the stools. Okay. In addition, if you keep on straining for a long time, even the tubes will become weak, they will become dilated, pockets of intestinal weakness producing diverticulum, they may get infected and they may produce a lot of difficulties which may need even surgery sometimes. And repeated straining, what happens, the bowel is related to the urinary bladder. So, putting lot of pressure increases the pressure on the bladder and you could pass urine involuntarily, stress incontinence. See, all these things are very important, or you just ignore, let the motion stay here, I will not bother, I will keep on going. Yes, there is very space is there, at one point the motion will become a big ball, somewhere in the tip it will produce obstruction, okay. Then which may need a bigger treatment and lot of difficulties for the patients.
A lot of medical complications could arise from what you said just now. So, when do you think is the right time for a person to consult a doctor? How long should a person wait before he feels he should consult a doctor for this problem?
Exactly, it is a very good question. There are two parts, I will put it away from this talk or by their own knowledge or from the family tradition, people know. So, they can always try the what I said first, like drinking water, liquids, diet modification. If it does not work out, first thing is you get pain in the painful motion, when you pass the motion it is very painful, yes, you should better to consult the doctor. When there is a blood coming, yes, you must consult the doctor. Or you feel there is a, you always feel that there is something in after passing motion also something is still in the rectum or the bowel, better to see the doctor. Or if you are silently losing the weight, you have a constipation which is not troubling you straight away, but you are losing weight, silently you are losing weight, better consult a doctor. Or your hemoglobin or some other blood parameters are coming down, better to consult a doctor.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
So, once a patient comes to you, how do you evaluate that patient? What are the factors that you take into consideration?
These all are my first answers and current future answers will be somewhat related to each other, but it is very important. First we get into the diet history, what sort of person. As we discuss the diet history, the patient himself, many of the patients are now very knowledgeable and health conscious and they are aware of it. and they themselves will start agreeing with you, yes doctor, yes this is a problem, I have this work, that work, they will keep on agreeing with you. Diet habits are important. What are all the diet? Insist on certain amount of liquids per day, diet vegetables and fruits, plenty of vegetables and fruits, high fiber diets, reduce the fat food, reduce the caffeinated drinks and alcohol, go for activity. Exercise is what we tell, but exercise cannot be done by everybody, by a 75-year-old man or 80-year-old man, there will be different lady, pregnant, so many issues are there, but go for activity, be active. Even you are active, whether it is walking, running, climbing the stairs or doing all your work by yourself, going and picking up the phone, like small work, activity is important, but if it is possible you go to gym and do exercise, no problem about that. This food, diet, exercise, lifestyle. Those who have a job where they always sit in the job 12 hours, there is no much activity in the intestine.
The sedentary lifestyle.
Not only walking, just sitting there all the time, it is not going to help you. Also, people have the habit of passing on, there will be urge to pass stool, every human being will get it. You must immediately attend to that. You keep on avoiding it, passing it, slowly the colon becomes inefficient, it becomes lazy. This is very important. First diet, then the food, the lifestyle and bowel habits. The next should be the diseases, whether they have simple common diseases, sugar, diabetes mellitus, thyroid, which is very common. Many patients will have some family member having these diseases, they have a high chance of getting a constipation. By correcting the sugar, by correcting the thyroid or correcting any other underlying diseases, they easily have their constipation becomes much relieved. Okay. Also, you take medicine for a short duration, cough syrup, it will make you drowsy, it produces constipations. Some antibiotics, neurological medicines like fits medicines or sleeping medicines, psychiatric medicines, even hormones, all of them have a role all over the body, particularly the intestines. So they all produce, you check it, this is the reason, these are the, get a complete history of the all the medicines he is taking or taken, all the diseases which are common or uncommon. In addition, most importantly, they can have a disease in the intestine like your colon tumor, your growth, cancer can also be there. It may not be the every patient, but that is the diseases we are scared. These are the diseases we are scared. After ruling out, correcting and motivating the patient, the last thing we will go is for the, there is a possibility of a cancer, growth, obstruction, something big, something serious. Okay.
So there could be underlying causes also.
Yes.
So depending on
Yes.
all the factors, and again as you mentioned, medicine, the kind of medicines that
They
you take
is
can
very
also,
important.
yeah.
Nowadays people take lot of medicines.
So
We ask them 4 or
lifestyle,
5
your
times.
diet and
Yes.
how sedentary, whether your lifestyle
Yes,
is sedentary
active.
or not, active or not.
Bowel habits,
Bowel habits.
timely
These
habits,
things
and the
about,
urge to should not be ignored.
okay, okay. And in medical terms, how do you manage this condition other than the lifestyle changes in the diet?
We evaluate. First is the from the patient himself we can get what is the reason. He himself will say, sir, I am a diabetic for 18 years, sir, I am taking thyroid medicine for 6 years. Like that you get a complete history of the medicines, medical diseases. In addition, suppose he is not aware of it, we have to do all the blood tests to look for what is the reason for this. The second thing would be to go for imaging, simple ultrasound of the abdomen or a CT scan of the abdomen or an MRI of the abdomen. Sometimes we swallow the contrast barium and take barium studies, and more importantly in some patients we do tube tests, which you said in the starting, endoscopy, colonoscopy, we put the tube, we give injection to the anesthetist will give injection to the patient, he will be sleeping comfortably, you won't know anything. So you will push the tube to the rectum, anus orifice, we examine the colon, rectum and the terminal ileum to see any diseases. If something suspicious, we take tissue biopsy for testings. That is a very important tool available in the modern medicine, colonoscopy. And after particular age, we advise most of the people who have any intestinal disease to go through a colonoscopy to rule out coincidental or incidental medical diseases.
And some people have a tendency to go for self-medication, they may suffer from constipation for a while and they may decide we'll just get a laxative off the counter, and how safe is it?
Yes, see, as I told you, because this constipation or any medical disease nowadays, as awareness increases, education of the patient increases, there is also home remedies, there is also family traditional thinking
Remedies,
regarding these things, nothing wrong in it. Up to a certain level, you evaluate yourself whether I am taking enough water, no, whether I am taking enough liquids, whether I am taking enough fibers, or my food is very biased towards only particular kind of food ingredients, I am not taking any other things. All these days themselves can, whether I am sitting in the toilet sufficiently, sitting in the toilet sufficient time in a comfortable position also has a role for the people. Some people sitting in the toilet may have a cell phone, tab, read papers, it is nice as a culture, look nice, but all these things to be avoided. Even the type of toilet which had Indian style and now the Western style has a role, because it should stretch the lower muscles to, then the signal is, oh, the motion has to go, the colon reacts to that.
Okay.
So it is very important you get all these details to the patients, but home remedies, nothing wrong. Over the counter fibrils you can take, you can try for a short duration. That is why one important factor, if you have a constipation more than 3 weeks, you are allowed to do all these things for 3 weeks.
3 weeks.
It's a cut off.
Okay.
You can take you can go to the over the counter, you can buy some senna, you can buy some dulcolax, you can buy some fibers, powders, no problem. But if it crosses 3 weeks, you have to see a doctor. Or if there is a huge distension, if there is pain, abdomen pain, or you vomit, or blood is pouring out, or dribbling, or when you are passing motion extreme pain, you have to see a doctor, don't delay it. Do you understand this? So as long as all these things are not there flat, 1 or 2 days you can try, nothing, no harm in that.
So maximum 3 weeks.
Yes.
Ideally, after 3 weeks, the patient should immediately
even you don't have any
seek
symptoms.
help.
But if you have this associated symptoms,
then better not to wait.
Immediately go.
So would you like to share some tips to the viewers about how to avoid constipation?
Yes, as consciously, remember, as consciously you are, otherwise we may not take anything. If you are hungry, you take food. If you are thirsty, drink water, that is correct. But as far as possible, those who have constipation or those who want to avoid constipation, consciously take 4 or 5 glasses of extra water daily, what you are taking before, and compared to that, take 4 or 5 glasses of extra water. Take more bias towards the vegetables, fruits, cereals, legumes and prunes, things like that. Cut off, reduce this cheese and this high fat diet, high fat diet. Also drinks, fresh fruit juices, vegetable soups, salads, fruit salads, okay, but avoid caffeinated drinks, except bare minimum 1 cup or something like that. Avoid this alcohol. These are all the things you yourself can do. Check whether you are having any disease. You are sugar patient, whether your sugar is out of control, maybe sugar is not adequately controlled, thyroid whether it is adequately controlled, or any other disease, because common man I do not want him to keep exploring the medical lines, but he can definitely self assess himself, whether when the urge comes, whether he is passing, whether he is avoiding the stool because of some reasons. Also if you change the house, your lifestyle, or go to a new place, hotel, stay, all you could have certain amount of disturbances in the stool patterns because of the new place, etc.
So the patient has to evaluate himself initially to find out what is causing this constipation.
So panicking.
So doctor, before we wind up, any takeaway message for our viewers?
Attend to your stool calls, bowel calls, motion. Do not pass the urge to pass. Bowel fashioning at a very young age is very important, particularly in school days, formative years. Once you form the stool pattern and habits, it will stay throughout your life. Don't have erratic lifestyles, and smoking, caffeinated alcohol, the caffeinated drinks, alcohol cut. More towards vegetables and fruits, plenty of water and drinks, activity, anything from walking to gym exercise, anything is available. Very good activity is very important, aggressive activities, and if there is a warning sign, as I told you, like anything over 3 months, pain, bleeding, distension, vomiting, anything abnormality, loss of weight, or any recent constipation. For example, you never had this problem, suddenly you are getting constipation. Constipation never been a problem, warning signs, immediately consult a doctor. All the facility, currently we can do all kinds of evaluation to find out what is the reason, or we can give you best advice.
Thank you so much, doctor, for taking time out from a busy schedule and for answering all the questions in detail. Really appreciate it. Thank you so much.
Thank you so much. Very kind of you. Thank you.
Friends, with that we come to the end of today's episode. As Dr. Suresh rightly suggested, please follow a healthy lifestyle. Make sure that you exercise, you move your body, stay hydrated, eat healthy, stay healthy and happy always. Till we meet again next time, this is Anupama signing off. Don't forget to tune in to BMC Global Live Al Hilal Health World every Tuesday at 8 p.m. Good night.
Thank you.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 48 06 38 85 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.